as far as the slow spread, apparently, of the virus in African settings and whether BCG makes a difference, we do not yet have the evidence that clearly indicates that BCG might make a difference. I think this is being studied and being analyzed and written about by some scientists. There have been lots of speculations about whether the temperature in Africa makes a difference, but we've seen that in some West African countries where the virus has spread rapidly at the community level, these are places where the environment, the temperatures are very hot. So we need to continue to understand, and we think perhaps some of the measures that had been put in place, because the virus came later to Africa than it did in some other regions, and some measures had already been put in place. We think some of the early alerts, screenings that were taking place made a difference in some of the countries. The challenges now are really those of confronting the shortages of test kits and other key items that are needed to scale up and to decentralize these interventions.
Merci, Dr Moeti. Et on veut aussi maintenant poser cette question en français, peut-être à Dr Yao. On commence tout d'abord avec une question de Rein Nzingui, de la radio et télévision gabonaise. Et il pose cette question, évidemment, quelle est la situation épidémiologique actuelle du continent africain? Et puis, on voudrait aussi vous poser la question qui était posée avant par Kelly en anglais, notamment quelles sont les leçons qu'on peut apprendre de l'Afrique du Sud en ce qui concerne leur confinement, par exemple. Et aussi, évidemment, il y avait cette question sur la transmission qui paraît être plus lente en Afrique, quoique, évidemment, vous avez parlé aussi de la situation d'une augmentation des cas, notamment, je note, dans les pays francophones comme Niger, Guinée, Côte d'Ivoire et Cameroun. Donc, Dr Yao, si vous pouvez nous parler de ces questions et les réponses.
Merci beaucoup. En ce qui concerne la situation en Afrique, on a un peu plus de 17 000 cas si on prend tout le continent africain, avec un peu plus de 900 décès, ce qui fait une létalité un peu plus de 5%. Mais parmi ces létalités, comme a été mentionné plus tôt, il y a certains pays qui ont une très forte mortalité. Certaines explications pourraient être aussi dues au fait qu'il y a eu des décès dans la communauté. Et la situation montre aussi qu'on peut encore faire quelque chose en Afrique. Notamment, il y a 28 pays qui ont des transmissions, qui ont des cas sporadiques, et il y a à peu près 14 pays qui ont des cas au niveau de groupes de personnes, mais qui semblent tous être liés. Et malheureusement, il y a certains pays évoqués plus haut, notamment en Afrique du Sud et en Algérie, où il y a une transmission au sein des communautés. Donc, pour la plupart des pays, on peut encore contenir l'épidémie si toutes les mesures de santé publique sont appliquées de façon rigoureuse et s'il y a une mobilisation entière des communautés, comme la directrice l'a mentionné plus tôt. En ce qui concerne l'Afrique du Sud était déjà en mode préparation avant les premiers cas, et les mesures qui ont été mises en place semblent porter des fruits, même s'il faut les analyser avec beaucoup de prudence. Il semble que la courbe est en train de se stabiliser. Ces mesures consistent à une recherche active de cas. C'est vraiment une des bonnes leçons. Lorsqu'on met en place des mesures de confinement, il est important qu'on puisse retrouver les cas, qu'on puisse les tester et qu'on puisse isoler les cas positifs. Donc, c'est une des mesures assez importantes. L'Afrique du Sud étant aussi un des pays qui a décentralisé la capacité de test. Et cette décentralisation est d'ailleurs nécessaire dans les pays où on note un plus grand nombre de cas en dehors des capitales. C'est vraiment une des priorités que doivent considérer plusieurs pays. En ce qui concerne le fait que l'épidémie avance à une vitesse beaucoup plus lente, c'est certainement lié aussi aux mesures qui sont prises beaucoup plus tôt, notamment la fermeture des écoles et autres. On entre déjà il y a plusieurs pays qui terminent leur deuxième semaine et de ce qu'on a observé aussi à l'extérieur, on commence déjà à avoir des effets dans la troisième semaine. Donc, ceci peut contribuer à cela. Le scénario en Afrique ayant été l'importation de cas et ensuite prévenir que ces cas-là puissent contaminer les communautés. Il semble que ces stratégies aient peut-être ralenti aussi la propagation en Afrique. Et donc, on peut changer la figure de cette épidémie en Afrique si on intensifie les mesures, si des moyens sont disponibles, notamment en termes de tests et aussi moyens de protection, et si on ajuste aussi la réponse au contexte africain où on a une promiscuité souvent au sein des familles, en mettant l'accent sur l'hygiène et en mettant l'accent aussi sur la distanciation physique dans les milieux physiques et dans les milieux où cette promiscuité se passe, notamment dans les marchés et autres. Et si on introduit de façon contextuelle le port de masques dans ces milieux publics ou bien d'autres mécanismes de protection dans les milieux publics avec une mobilisation effective des communautés. Merci.
Merci beaucoup, Dr. Yao. We have a question for all of our panelists from Joseph Hinks, Time magazine in Turkey. See if we can get Joseph on the line to pose his question.
Yeah, hi there. Thanks for having me. I have a question about the role that the WHO and possibly also the WEF can play in ensuring equitable access to COVID-19 medications and to future vaccinations, particularly for African countries. Should these organizations be involved in attempting to prevent rich nations from monopolizing COVID-19 treatments and medications? Thanks.
Very good question. Perhaps starting with Elsie on that. Elsie, are the WHO or the WEF in a position to actually prevent any of those measures? What can organizations like ours do when faced with this kind of crisis of distribution that may come when we have a vaccine?
Yes, Adrian. Again, it's always good to build on lessons of the past, and coming out of the Ebola pandemic, among others, in Davos during the annual meeting in 2017, the forum facilitated the launch of a coalition for epidemic preparedness innovations, which essentially was fostering cooperation and collaboration amongst different stakeholders to develop vaccines against epidemics. In the aftermath of this COVID-19 outbreak, earlier this year, there was an announcement by CEPI calling on a new partnership, obviously accelerated in terms of asking the different companies involved, but there are other stakeholders involved in the ecosystem of arriving at safe, effective vaccines. Apart from support from the Gates Foundation, we've also seen Gavi step up and other stakeholders contributing. And so the forum continues to play this role of trying to bring on board as many partnerships as we can and to maintain an equitable approach to it. It's all about solidarity. We're in this together. It does not make sense to support just one part of the world and not the other, as we're all vulnerable.
Thank you. Dr. Miziri, the Red Cross is obviously on the ground dealing with humanitarian crises around the world. How does an organization like yours make sure that when a vaccine becomes available, the most vulnerable people can have access to it?
Well, we will not be vaccinating. We will work with the health authorities, and our staff, our volunteers will support the vaccination, but not, in terms of campaigns, in terms of organizing it on the ground, accompanying it, but we will not be doing it. That's not our job. On the equity issue, that's difficult, of course. When you have the whole world affected one way or another, with different degrees of severity, the normal instincts of politicians certainly is to protect your own people, protect your own population. And we've seen it even in our world when, we have great, our organization is based on solidarity. It is about helping each other in difficult times. So we had even, you know, in the most difficult moments of situation in Italy, Italian Red Cross was receiving support from all over the world, you know, from China, from Algeria, from all sorts of countries through our channels. And then we heard that people in these countries were, you know, saying on the social media, yeah, but what about us? We are also suffering in Algeria. We don't have enough PPEs. So the only way to deal with it is appeal to, you know, strength of solidarity, to the best of human values. I mean, we're all tested during these times of crisis. And we know that sometimes, you know, the worst in human behavior comes out, but in the majority of cases, actually, the real humanity prevails. And we will advocate for it with our passion, with our principles, through all our channels, joining forces with the UN family, with the WHO, with the World Economic Forum, and anybody else. That would be my answer.
Thank you. Dr. Moeti, returning to you on this question of what can be done to ensure that the world's neediest people get access to these vaccines when they come online.
Yes, I think that, well, first of all, we would, and we are encouraging African countries to join in the efforts to find a vaccine by being involved in the clinical trials for vaccines. This is important, so that we contribute from the continent also in the science and the research for finding a vaccine. We are encouraging our countries to do this, and equally to join into the solidarity series of clinical trials that are being coordinated with different partners, in which WHO is very much involved, so that we contribute in that way. And then secondly, I can only say that WHO is very much part of these coalitions that Ms. Kanza referred to. CEPI, we're very involved in the work that CEPI is doing, Gavi. There is also a role of advocacy, which WHO carries out. So at the global level, our Director General, for example, addresses the G7 countries, G20 countries. These are fora in which people can make the correct decisions. We work very much with the African Union and are involved with them, including with the Director of the Africa CDC, who is a WHO global special envoy on COVID-19. To carry out this advocacy. I also think at the community level, so if you look at the Red Cross, for example, which has members and branches, people of communities all over the world, I think that citizens themselves can influence the decisions of their countries if they're aware of the potential for some of these commodities to be made available by actions of their countries. We need to continue to strive for this global solidarity, even in the context of the geopolitical situations that the world finds itself in today, which is very challenging as compared to what's been happening over some decades ago. So in WHO, we very much are involved in advocacy, continued advocacy, working in partnership with the different coalitions and in sensitizing our own countries to carry out bilaterally, if needed, some of this advocacy and negotiation with our better endowed partner countries.
Thank you very much, Dr. Moeti. I think we can go to India and to Sonal Jindal from Mood Board for a question for the panelists.
Yeah, hi, this is Sonal from India, and I run a mood board consultancy firm. Few of our clients are the media houses. So my question to Dr. Moeti, Dr. Simone, and LSA is that before COVID, we were talking about climate change, environmental protection, and other such things like sustainability. But post-COVID, what is the plan? I know it is too soon to ask the plan, but are we going to talk about the sustainability of mankind, and what is the measures we are going to take for the human protection moving forward?
Thanks for that question. And perhaps we can also go to Nigeria and Ohi Odahai from Arise TV.
Thank you very much. My question is to the WHO rep. Talking about Africa, knowing our poverty rate and huge population, how realistic is social distancing? And my second question is, how long are asymptomatic carriers contagious? Thank you.
Okay, thanks for that. That's a genuinely busy newsroom behind you there in Nigeria, Rohi. Dr. Moeti, perhaps I can turn to you first on that. Maybe Oi's question on how practical social distancing is, and also perhaps the underlying question asked by Sonal, which is really, there are a lot of other big issues affecting human well-being on the agenda before this pandemic came along. And what kind of perspective do we need to observe, perhaps, when we think about the pandemic going forward and the other issues that we still have to deal with?
Yes, thank you. Two very interesting, challenging questions. There is no doubt that social distancing is difficult in some settings, extremely difficult, and perhaps especially when we consider that component of asking people to stay indoors and not go out in some settings in the ways in which people are living is simply not going to be possible. And if we take into account the size of dwellings, the size of families, and the weather and the climate in some places is going to be very difficult. So it is important that this be understood. It is important that it be applied in a way that's contextualized to the reality of people, but it also needs to be supported and enabled. So I think my colleague said very clearly that, for example, when people are going to the type of places where we go shopping very often in African settings, the markets where we buy our food, it's very difficult there to keep people apart. These are informal settings where I imagine if you are the person running a store, you're not going to be the person reminding your potential clients to stay away from each other, because in this way, then you might disadvantage yourself in terms of what you're going to earn for that particular day. So this is what we were saying earlier about perhaps the need to consider additional protections, the use of masks for people going out to do their shopping while we try to, the best possible, to minimize the distance. I don't think we should give up on this altogether, but I think we also need to understand that it's not possible for the police to enforce staying indoors in some areas where it's simply not feasible that families will do that in a way that's at all bearable. And then it's become very important to enable the other measures, the other hygiene measures that my colleague already mentioned, and Elsie mentioned how the private sector is supporting this, making sure that people have access to these sanitizers, to running water, to soap, and are able then to practice some of those measures, and possibly even the use of masks if in the house, if it's not feasible for them to be distancing away from each other within the house. It's something that we have recognized and that we are advising governments to apply in a way that is feasible in the context of countries. And then secondly, the question about the many other important issues of life in communities for the planet. I think it is a very good reminder that our concern with the response to the COVID-19 needs to be put in the context of all the other important issues that need attention globally. I mean, we emphasize very much in WHO, starting at a pragmatic level, the fact that we need to help countries, or countries need to make sure that they're providing essential health care for other diseases. Otherwise, we will see an even greater impact of this pandemic. So we need to be aware in the way of putting in place response measures of potential impacts on the environment, and need also to be taking into account some of the basic measures that are being taken place, how to dispose of waste, for example, and continue these as part of, if you like, the integral way in which we live life in today's context, where all of these will simultaneously be having an impact. And I think this is why it's so important to have, if you like, not only the public health response, but a socioeconomic response as well. At the level of the UN, there is a strategy document being developed which will take into account all these other very important aspects of life on the planet.
Thank you very much. We have Nathaniel Lucanio in South Africa from Business Day on the line. Nathaniel, can we take your question? Just checking to see if we can go to Nathaniel in South Africa.
Oh, good afternoon. Thank you very much for. Oh, yeah, okay, I'm there. Good afternoon. Thank you very much to the panel. And I guess it's just a simple question, Dr. Moeti. You mentioned earlier the economic costs for Africa, how severe they're going to be relative to other places. And like when you, my question is really about how long in a country like South Africa, for example, where people can see the economic costs, they're quite obvious. We all see how people are losing their jobs, like informal businesses having to close. And then on the other hand, the issue of whether or not the lockdown is working is hard to assess because, as you said, because the testing is limited, so we don't actually know. So in a situation where you've got people that can see a huge economic costs, but are not really sure about the benefits, how long do you think we can actually sustain this sort of lockdowns without actually having our people actually rebel against them? Thank you.
Thanks for that, Nathaniel. And also we have a question from Philippe Balfroy at AFP in South Africa, who says that earlier this week, an epidemiologist, Professor Karim, who was advising the South African government, said he expects the peak of the pandemic to reach South Africa only in September. He's also said that the exponential spread is almost unavoidable throughout the continent. And Philippe asks, does this assessment match WHO forecasts for Africa? So both of those questions, and perhaps we can also get the opinions of other of our panelists on the line. Dr. Moeti.
I think the question of how long these lockdown measures can be kept in place before they really become unbearable for people and they start to react is a very important one. And I just like to say that that is why it is important to put in place mitigation measures from the very beginning when these programs or interventions are put in place. Thinking about the implications, what are the potential impacts on people's lives, livelihoods, and so on. And in a number of countries, this is being done. We are advising more countries to start off at the beginning with having planned at the same time these mitigation measures that may make then countries be able to benefit from putting these measures long enough to be able to have effective public health interventions that will bend the curve in place. So I think there are a number of parameters that need to be taken into account. Obviously, how the evolution in terms of new cases and how the virus is spreading, and if the measures are starting to have an impact. WHO is just releasing a strategy document and guidance on this in the next couple of days that will enable countries to be able to figure out how to program, if you like, and how to analyze the impact and whether the measures can be lowered or not. And I think it's important to also realize that it's not a matter of all or none. As I said, in South Africa, for example, the measures were progressively introduced. It might be that when there are observations that in some localities, the situation is starting to show an impact, some of the measures can be reduced while others are sustained in order to make sure that you then don't have an upsurge of cases if we do this abruptly. Yes, I did see Slim Abdul Karim's presentation, though I wasn't able to follow all of it. And we're asking our country office to also send us their analysis on how these measures are going to, what impact these measures are going to have on different countries. In the majority of countries so far, what we have done as WHO is to carry out projections of the evolution of the epidemic if the measures are not very effective. I think that we do not yet have an idea of when we think, how much time we think it'll take if really effective measures are put in place before we start to have a change in the situation. I'll ask Michel to come in on this. Perhaps he might be aware in more detail of some of the projections that our team has been carrying out on this matter. Michel, please.
Yeah, thank you very much. It's quite difficult, this estimation, and most of the estimation are based on the fact that if something is not done, then you can read these cases. We have estimation in the coming 3-6 months mentioning about across all the countries in Africa, more than 10 million. At least severe cases that could happen, but these are still to be fine-tuned. It's difficult to make a long-term estimation because the context changed too much, and also public health measures, when they are fully implemented, they can actually have an impact. We have some of the modeling when we had Ebola that did not turn into reality because the interventions were stronger and faster, even if it was longer, but we never reached these alarming numbers. So we have to be cautious. There is many factors that need to be taken into account, including geographical access of some of the areas. So the disease may take time to reach or may never reach some of the remote rural areas, and all these are count as African population. So it's difficult, and we have to be cautious. We need to emphasize on public health measures that can turn the most of the estimation not to be accurate. Thank you.
Thank you. And Elsie Kenza, you're in touch with many of the key government ministries and businesses across Africa. What's your feeling about this delicate balance that's got to be struck between keeping economic activity going and also protecting public health?
Thank you, Adrian. As we both sit in Geneva, you can see that this is a challenge in Europe as well. Once you shut down or lock down, how do you start phasing the opening up? What we know for sure is that we're not going to operate as we did in the past. We will have to maintain different ways of social distancing. We're already seeing that when you go to the shops, when you go to the bank, there's restrictions on how many people can be in an enclosed space. We very much expect that this will be the case in Africa as well, as the countries evaluate how they can return to normalcy. And if you allow me to just go back to the question around how we take into account other realities, because I think this has a bearing also on how you restore some kind of normalcy. Just this morning, an example related to food, we launched a regional food systems action agenda, bringing together different stakeholders in the food ecosystem to see how we address the immediate shortage, the effects of the lockdown, how we can come up with innovative solutions to farmers so that they plant. It's raining. If the farmers don't get the credit they need, the fertilizer, the assurance that there will be buyers, they will not plant. Africa is still a net importer of food in the billions of dollars, unfortunately. And what we're seeing in Asia, for example, is negative effects of climate change. So we cannot rely on certain staples to come from Asia because they will not have enough to export, leave alone export bans. Supply chains being disrupted by border flows. So there are a lot of different elements that need to be taken into account, which is a reality pre-COVID and the challenges arising therefrom, but also think about the opportunities. What's the opportunity of the Africa Continental Free Trade Area Agreement? And so I can assure you that the governments, we had some ministers participating, they're very much on board about how we can collaborate, and very importantly, how we move together in the same direction. So information sharing, the role of data is also playing a critical part. And with all these elements coming together and with the support of different entities working together to support the African Union in particular, the Africa Center for CDC and the WHO, so that we are coherent in our actions that impact, I believe we will find a way to live through this crisis in a much more optimal fashion.
Merci, Elsie. Okay. We actually have on the line a French journalist that we can turn to. On vous écoute. Can we bring Roger in, please?
Okay, yes, thank you. Merci, je suis Dr Roger Moyou de Canal+ Afrique pour l'émission Bonjour Santé. J'avais une question à poser concernant les chiffres et les données de l'épidémie actuelle en Afrique qui sont assez bas par rapport aux estimations qui ont été faites par certains. Et la question était de savoir si c'était dû simplement à un manque de moyens d'évaluation ou si on pouvait déjà parler d'une certaine spécificité qui protégerait les Africains contre cette maladie. Et une autre question qui concernerait aussi l'état de la recherche aujourd'hui en Afrique sur le Covid-19.
Merci. Merci. Et peut-être on écoute pour cette question aussi ou bien le Dr Moeti ou bien Dr Yao.
Oui, merci beaucoup. Bon, je vais demander à Dr Yao de répondre à ces questions. Michel, s'il te plaît.
Merci beaucoup. Les chiffres donnés en Afrique sont bas, probablement parce que, comme je le disais tantôt, le scénario était l'introduction de cas et prévenir la propagation dans la communauté. Et il y a environ 28 pays en Afrique subsaharienne qui sont encore au stade de cas sporadiques et pour lesquels, si une activité intense de santé publique combinant la détection précoce, les mesures de distanciation physique et autres sont mises en place, on pourrait éviter cette transmission. Donc peut-être et probablement que les mesures prises assez tôt comparées à d'autres régions limitent cette propagation, sans aussi sous-estimer le fait que cette maladie a une forme aussi asymptomatique pour lesquelles il est difficile de détecter. L'idéal aussi pour l'Afrique, pour être totalement rassuré de cette tendance-là, c'est de multiplier la capacité de tests. C'est lié à la disponibilité, malheureusement, de ces tests-là. On en a déjà mentionné, demandant une certaine solidarité pour que ces tests soient présents pour permettre d'être rassuré de cette tendance. En ce qui concerne la spécificité, on se rend compte dans les statistiques actuelles que la plupart des cas sévères ont un âge au-delà des 60 ans. Donc, ceci corrobore un peu toutes les évidences qu'on a collectées depuis. Et si cela se confirme, l'Afrique pourrait avoir un avantage avec une population nettement plus jeune, même si on a une méconnaissance encore de l'interaction avec la prévalence de certaines maladies comme le paludisme, comme la tuberculose et puis aussi le VIH-Sida, mais ce sont des aspects qu'il faut soulever et cela me permet de rejoindre la dernière question. L'aspect de la question, c'est la recherche. Il faut absolument qu'il y ait des équipes de recherche en Afrique qui puissent examiner tous ces facteurs-là qui font la spécificité et pour permettre une compréhension globale de cette maladie. Et l'OMS travaille d'ailleurs à encourager ces équipes et cela aussi me donne l'occasion d'aborder un terme qui a été abordé dans le passé. Il est nécessaire aussi que des essais cliniques puissent se faire en Afrique, mais en accord avec les réglementations, avec l'approbation des comités éthiques. Et si cela est fait selon les standards, cela permettra aussi de comprendre et de connaître l'efficacité de certains médicaments ou vaccins potentiels pour l'Afrique. Merci.
Merci, Dr Yao, pour cette clarification. Et on tourne maintenant peut-être vers les dernières questions en anglais.
Thank you, Peter. And final question to Drs. Maziri and Moeti. Access to sanitation is a cause for concern for many impoverished communities, asks Andre Van Wyk from allafrica.com. Andre also asks, are there other risk factors in Africa that your organizations believe would exacerbate the impact of the pandemic, and what could be done to remedy them? Big question. We only have a couple of minutes to give answers. If I can turn perhaps first to Dr. Maziri in Nairobi.
Thank you, Adrian. Yeah, this is a very big question. I think what we're all realizing is that copy-paste from what the Western nations or Northern Hemisphere was doing or is doing in response to this disaster is not going to work necessarily in Africa. And Dr. Maiti already referred to very complex situations we have in slum areas, we have refugee camps, we have very particular family structures. Isolation is very difficult. How do you isolate, for instance, to protect them elders when they're integral part of the family? So it is all calling for non-standard, I would suggest, solutions, like, for example, if it's dealing with the slum area, using where our members are doing it, volunteers going in, they are oftentimes part of these communities, they work through the youth, they work through the community leaders to explain, to establish water points, to enhance water points, because water sanitation indeed is a key thing there, to provide protective masks sometimes. So it is all tailor-made, community by community, and that's how it's going to work. And one other thing I want to say, you know, we all want, as human beings, to know what's the date when this horrible story is over. And unfortunately, it's impossible to say it. And I think WHO is very clear. So there's lots of speculations when the measures will be lifted. I think what is important psychologically, and here's the role of media, help us to pass that message. It's a long journey. It's not going to be over tomorrow, and we all need to brace for. It's a marathon. So it requires sacrifice, and of course, the economy is suffering. Of course, you know, informal sector in Africa is suffering. But the other side of the equation is loss of life. So what is more important, loss of life or economic downturn? And these are the choices which people have to be made, which politicians are making, and that's what we have to live with for the coming month. That's for sure. Thank you.
Dr. Maziri, thank you. And just back to Brazzaville, Congo, for some last words and thoughts from Dr. Moeti.
Yes, thank you for that question. I mean, other conditions, of course, that might affect this is the conflict situations in some countries in the region where simply the presence of interveners is going to be a challenge, and being able to in a systematic way put in place some of these measures might be difficult. We have high levels of malnutrition in some of the countries, both among young children, pregnant women. So these could add to the vulnerabilities. But I'd just like to end by saying, in terms of the difficulties, you know, we've seen in the context of very difficult situations like an Ebola outbreak, people adopt very extraordinary measures that are completely against how they would normally behave. And this has been achieved by people understanding, internalizing, and finding their own way, feeling a sense of agency, how to deal with these difficulties. I have a lot of faith in African people and communities. I think our duty is to help people understand in the simplest way possible, in an idiom that they can understand, in non-technical language, what it is that this is about, what it is that they need to do, and then to support them, to put in place those mitigation measures that sometimes go well beyond public health interventions, how we'll gain their trust and how they can be part of this response as well.
Thank you so much, Dr. Moeti. Thanks to all our doctors, Moeti, Yao, and Maziri. Thanks to my forum colleagues, Elsie Kenser and Peter Vanham. And thanks to all of the 170 or so journalists who participated and are questioners today from the World Economic Forum here in Geneva and this Africa media briefing with our friends at the World Health Organization. Goodbye. See you next week.
Au revoir.